Honorable dignitaries on the dais and all participants in the audience. I walked an hour back and Dr. Rajan was surprised. He mentioned that all the audience was asking Amit Shah, Home Minister is coming from Delhi. So I'll just take 50 seconds. In the first 25 seconds, I hope no one is keeping a stopwatch. I'll talk about what the work that we do at Resolve to Save Lives, and the next 25 seconds I'll talk about what drew us over here to come and see the work of the Sapiens Foundation in person over here. At Resolve to Save Lives, it has been set up as a global initiative 5 years back with a very ambitious goal of saving 100 million lives from cardiovascular disease over the next 30 years. Now, it's a very ambitious goal, but it has been set up as a partnership with the World Health Organization, World Bank, Johns Hopkins University, and a range of global partners. In India, we have been working over the last 5 years with the Indian Council of Medical Research, WHO, and a lot of organizations through which we have demonstrated a lot of success in various interventions. Now, how do we reduce those cardiovascular deaths? We have identified 3 strategies. Number 1 is hypertension control. Can we achieve the global coverage of hypertension control from, let's say, 14% to 50%. Second is, how do we ensure that we eliminate trans fat from the diet, which definitely it's considered as the equivalent of nicotine in nutrition. And the third is, how do you reduce population level salt consumption by 30%? Now, all these are very, very significant public health challenges. In hypertension, we have been able to achieve significant successes working with our partners. We have now been able to diagnose 4.5 million patients across India with hypertension and put them on treatment. Trans fat elimination, India has shown the leadership by actually enacting a policy, but now it is translating it into action by eliminating trans fat, which is again a long task journey ahead. The last but the most important is salt consumption. Achieving 30% reduction in salt consumption is easier said than done, when 80% of the salt consumption happens at the household level. So what are the unique behavior change strategies that we can deploy as a society that can really help us from the silent epidemic? I'm not getting into the numbers because Dr. Narasingan sir and Dr. Rajan sir have already spoken about the hazards of it. But it's how do we achieve it that is important. And that is the reason the work of Sapiens Foundation is so very important. Because what they've been able to do is to increase the patient awareness on key health issues and educate them on preventive and lifestyle management. Dr. Rajan definitely should serve as a role model for the medical fraternity, not to focus only on the curative component, but also on the preventive and the lifestyle management. If we have to collectively achieve the reduction in salt consumption, the audience today itself gives us a lot of hope, because it's a collective effort. It's a whole of community effort where we'll have senior leaders, where we have celebrities, where we have grassroots organizations, where we have leaders from the medical fraternity, and as well as community members and patients all together. So only if we are able to join hands, I think we'll be able to do that. Thank you very much, Rajan sir, for inviting me over here. I hope it was